Pleasant good morning, everyone. On behalf of the Director General, Ministry of the Public Service, the management and staff of the Psychiatric Hospital, and the Learning and Development Directorate, I welcome you all to this webinar entitled Identifying Pathways for All Toward Mental Health in an Unequal World. This webinar is in observance of World Mental Health 2021 and is being brought to you today by the Ministry of the Public Service, Learning and Development Directorate in partnership with the Ministry of Health and Wellness Psychiatric Hospital. World Mental Health Day was observed for the first time on the 10th of October, 1992 by the World Federation for Mental Health and continued since then to be commemorated annually on October 10th. The Psychiatric Hospital has traditionally celebrated World Mental Health Day with a week of activities starting on October 10th. Ladies and gentlemen, I am Jeanette King, your moderator for this morning, Human Resource Officer at the Learning and Development Directorate. Over the past year, mental health has been in the news continuously, particularly as an impact of the COVID-19 pandemic, an acknowledgement that the pandemic poses risks beyond our physical health. The mental health effects of the pandemic have not been the same for everyone. The vulnerable groups include, amongst others, the unemployed, those with existing long-term physical or mental health conditions, and older persons who are isolated or digitally excluded. Borrowing from the words of Dr. Vanessa Penfold, co-founder and research director of the McPenn Foundation and a member of the COVID-19 Impact Inquiries Expert Advisory Panel, now is the time to channel this interest and commit to making things better for people who were struggling before and during the pandemic. We must also use greater interest in mental health from the public and from our government to strengthen action on inequalities so that we can tackle the causes of poor mental health. In this morning's webinar, we not only seek to tackle the causes, but recommend solutions. We start with building awareness of those factors that contribute to lack of access to mental health care and discuss the role that we can play in improving mental health and healthcare in general, and their access for those more vulnerable groups and ourselves as well. Before we begin, here are some protocols to optimize your participation in this webinar. We would like you to mute your microphone and turn your camera off. Please minimize distractions as much as possible. Most of all, please do participate fully in the webinar. Reflect on your own experiences. Share with us in the chat. At various stages during the presentation, you can make your notes and place your questions, comments, or queries in the chat box, and they will be shared with and addressed by your presenter during our questions and answer segment at the end of the presentation. The chat box can be opened by clicking on the chat icon at the bottom of your screen. Please note that this presentation is being recorded and the recording will be made available to you on the Learning and Development Directorate's YouTube channel. At the end of the webinar, a link to an evaluation form will be placed in the chat, and you are encouraged to complete the evaluation form and submit it to us forthwith. Your feedback is very important to us. It assists us at the Learning and Development Directorate to improve and enhance our productions that we deliver to you. Ladies and gentlemen, it's time to begin. And we have with us this morning to discuss how we can address mental health care for the benefit of us all, Dr. Joanne Brathwaite-Drummond, consultant psychiatrist attached to the Psychiatric Hospital's Community Mental Health Care Program. Welcome, Dr. Drummond, a pleasure. I will now allow Dr. Brathwaite-Drummond to share her screen.
Good morning to everyone. I hope that you can hear me clearly. I'm coming to you from the St. Philip Polyclinic where I'm working this morning. I'm going to try and share my screen now so that we can get on with the presentation. Right. So this morning, we are going to talk a bit about what really underpins a lot of health. Over the last months, we've been talking about mental health, and persons have been flooded with information on coping skills and relaxation techniques and so on. And that's fine, but I think that we really do need to start looking at health different angles. So this morning, we are going to talk about mental health, the definition of mental health, inequality, inequity. We are going to look at the social factors that determine health of populations. We are going to try and look at some ways going forward, and hope by the end of it, I'll be able to highlight to you the need for health in all sectors. Before, mental health being defined as a state of well-being. So it's not just not having a mental disorder. So because you haven't seen me or another psychiatrist or a psychologist, does not necessarily mean you're mentally healthy. You are mentally healthy if you can realize your own potential, cope with the normal stresses of life, work productively, and contribute to your community. And as our little graphic here shows, the needle can go either way. So mental health is not if a person loses their mental health and goes to crisis, that the needle can't go the other way. And if the right interventions are made, then that person can go on to thrive and even excel. I also need to make this point very clearly because we often hear about health in a vacuum. And I want us to be very, very clear. Without mental health, there can be no true physical. The two are linked in such a way that that link absolutely cannot be broken. And I often say to patients, it is very hard for you to have a healthy mind in an unhealthy body. And if your mind is not healthy, eventually your physical health will also suffer. It's something that I and colleagues see every day in practice. Now, this little diagram here, this is actually the work of a psychologist by the name of Maslow, who would have made a hierarchy in terms of what persons need. Yeah, in terms of what persons need. I'm just getting a text from Mr. Ellis saying that my voice is going and coming. I'm not so sure I can do very much about that, but I will try. In the polyclinic, our Wi-Fi is not the best. I will do what I can. So Maslow's hierarchy of needs says that basically, if we want to get up here, where a person achieves their and is able to do their full activities, creative activities, and so on, before we can get to the top of the pyramid,
in a big lot that you can, that you know, 6,000 a miss, but it's still saying
we can indeed. There isn't a lot that we can, in fact, do to get here if we're not dealing with the basic needs. So food, water, warmth, rest, security, safety. These basic needs have to be met before we actually realize true mental health. Now, it is not the most popular thing to say, but we need to understand that in all societies, inequality exists. Even in countries that are wealthy, for people who are less well off. And the research shows that by virtue of being poorer, you a shorter and less healthy life than persons who are more well. And that is just a basic fact. And we have to accept that those differences in health and health outcomes, they are a social injustice because these are modern societies, and we have to get to the stage where to do breathing techniques and employ your coping skills and do progressive muscle, really need to examine and address what are called social determinants of health. So, not to kill you with jargon, let's just have a look at what these so-called social determinants are. When you look at them, they're really quite basic. Food quality, food, education, person live, housing, that they have the money to support themselves or not, if they have access to healthcare, and if they are in contact with community, if they have social support. So these very basic things are in fact the social determinants of health. And it doesn't make sense for us to expect persons to be healthy if we are not addressing these areas of their life. So what we know is that mental health and a lot of the common mental disorders are actually impacted very heavily by where people live and the social and economic conditions that they live under. And when persons do not have the basic things that they need, this leads to social inequality. And those social inequalities increase the risk of a lot of the mental disorders that we see. So from social inequalities now, we go to health inequalities. What are health inequalities? Well, if we use Scotland, for example, as a first world country, we look at what happens there just by virtue of having more money. A person in Scotland, man or woman, will actually live 20 years of healthy life more than somebody who is poor. If you look at life expectancies in that same population, just by virtue of having a learning disability, your life expectancy, how long you live, is actually a lot shorter than if you didn't have one. And when you look at these things, these are not things that people choose. Nobody goes and picks learning disability out of a hat or off of a tree. These are things that persons cannot help, that many times they are born with. This is advantage that is conferred on a person through no choice of their own. Yet they actually are having significantly worse health outcomes just by virtue of this being a factor in their life. So we need then to look at equality. But is equality enough? And I just want to share this little graphic with you because that equality, we need to look at equity. Because equality, and I'll touch on this in our society, equality is everybody the same thing. But as we can see, our fellow on the left, he actually doesn't need any help. Without being helped, he would have been able to achieve the goal of seeing over the fence. Our little friend in the middle, he does the same help that this guy can't get there. So equity actually looks at meeting people where they are and giving them according to their need, not just across the board. And I'm going to turn this again as we go through. So from public health
That
in
was
England,
just I'm watching that elderly lady that was talking just now. I was just admiring.
playing field where are highlighted that will in fact give a person a good shot on the higher end of the scale. So if you have a good start in life, if you're in control of your life, you have a good job, you have a decent standard of living and have a safe home and community, then you have a good chance at having good outcomes. We know that persons who are on this end of the unlevel playing field. So, well, it's a matter
Masters
taking action,
2010,
and it's
2010.
across the lifespan of waiting until a person. It's not a matter of waiting until a person is, because that is often when we get persons who have mental health problems, when they're adults, often, in fact, not even until actually inequalities and mental inequalities before birth. But as we will see, as we go through the presentation, persons start to be in their health outcomes are determined even their birth.
Good morning, colleagues. We seem to be experiencing a minor technical issue. Could you kindly hold for just a moment, please? Also, colleagues, we have persons. Dr. Drummond?
Yes, I am there.
Okay, thank you. We had a couple of issues there, and we'd like our participants to cooperate with us, please, and ensure that their microphones are muted so that we can optimize, make the most out of this session. The information is very important, and we would like everybody to be able to hear it comfortably. So thank you all. Back to you, Dr. Brathwaite-Drummond.
Yes. So as I was saying, I have just listed just about every government ministry. And I hope by the end of it, I show you that it's not just the person in mental health or working, it's not just the Ministry of Health and Wellness that needs to work towards mental health. Every single one of our government departments has a role to play in moving Barbados towards greater mental health. Let's look at it. Early life. We know that when a person early period, this is in the womb, if they're not growing well, if their mother is not nourished well, that disadvantage is actually built into that person's biology. So their outcomes in adulthood are actually being impacted by what is happening even before they're born. Are actually laid in early childhood and before birth. So we know as well that the risk to a development tends to be higher if the mother of that child is living in poor social circumstances. And that is just, it is not something that we may necessarily want to think about, but to make any kind of inroads with respect to health and mental health that we need to look at. So what needs to change? Well, the general standard of living for mothers, even before first pregnancy, the type of education that they receive to know before they get pregnant, is now a good time? Is my body healthy? And what are the preparations that I need to make before I'm pregnant and add a child to the circumstances I live? We need good health education. We need good healthcare facilities. And yet we can say, oh, but all the pregnant women can go to the quality. But for example, we talked about equity, quality. So equality says that all of the pregnant women can go to the polyclinic and book and receive antenatal care. However, at this particular time, I believe if a woman books today, she should have what's called an anomaly scan, an ultrasound at 18 weeks. In order to have that scan done, she is likely to get a date if she's doing it in the public system. The date for the ultrasound, if her baby is normal, is likely to be after her date of delivery. So if a person has to depend solely on that system, if they do not have the funds to actually get something done privately, then if there are issues with pregnancy, they may not be picked up. And we're talking about the disadvantages conferred on a child even before they're born. And that is happening because of social differences and economic differences. So it may be that certain things need to be dealt with equally, and then other things need to be dealt with from the point of view of equity. We also need to ensure that parents actually understand what children need, that it's not just enough to pop out and just put on there. They need to understand what children need, their emotional needs, physical needs, and the type of stimulation that they need, the type of behaviors that they need to be able to pattern from their parents in order to be successful members of society. We looked at food. We saw food was a very basic need and also one of the major social determinants of health. Now, we've had a lot of talk about eating healthy and labeling and people making wise food choices, and I'm absolutely in favor of that. However, the research shows us that what people eat is more a factor of what they can afford than what they know about. So access to affordable food makes more of a difference to what people eat than health education. Because let's face it, if a person goes into the supermarket and they have X dollars and the healthy choices and the fruits and the vegetables and the expensive perishables cost more than X dollars, then they're not going into those salads. They're going to go and they will pick up the high salt, high sugar options, which fill you quickly, are cheaper, and they're going to move on. We know that people on low income families, so little who really do need to be well nourished, elderly people and the unemployed are the people who are least likely to be eating well. And how does this impact mental health? Well, apart from Bob saying that a hungry mob is an angry mob, we do know that poor nutrition and chronic disease have been established and set up that if you've got poor physical health, your mental health is not likely to be good. So what has to change? So this is where we talk to our folks in agriculture. So if you are logged on and you're from the Ministry of Agriculture and you figure mental health is my business, it is yours as well, because the availability of affordable and nutritious fresh food is extremely important. That actually a mental health policy is a mental health policy. We need to have accountability right down to the level of the consumer in terms of food regulation. And we need to boost agriculture in a real way so that nutrition and fresh foods are actually affordable. I want you to think of food policy as mental health policy. So we move on to housing, not something that people immediately link to mental health. But again, research shows us that housing is a fundamental factor when it comes to people's mental health. And I'll share with you an experience that I had. I want to say it's either last week or the week before last. I believe it was last week. I had a call to go and see a woman. I was told she was depressed and anxious and possibly in need of medication. Here with the mental health system, we knocked, but the door, if we had pulled, so not secure. We could not enter, not COVID, but because I was quite clear in mind my weight and the nurse's weight added to the weight of the occupants of the home, which was her and her minor children, all primary school age, would have been too much for the faulty support. And she captured this entire presentation very well. Brathwaite, thank you for, and I hope you will do everything. But I don't need medication. I need some place to live. If you lived like this, wouldn't you be depressed and anxious? People with those problems are at great risk of having mental health problems. So this is something that we have to address. The United Nations tells us that adequate housing as a fundamental human right is the right to live somewhere and dignity, fundamental human right. So what realize? So to the folks who are rural and urban development missions and housing, ensuring health.
Dr. Brathwaite-Drummond? Colleagues, excuse just one more moment. We're experiencing some technical difficulty. Do bear with us. These things will happen from time to time. So just give us one moment, please, while we try to have this issue addressed.
Again for personal phone. And keep us going. Are you able to see the screen?
Yes, Dr. Brathwaite-Drummond, we can see the screen.
Excellent. So let's hope that we can get through to the end. So we talk about the physical environment. We talk about regular exercise, protecting against heart disease, and so on. But we need as well to pay attention to how welcoming our physical environment is towards persons who want to exercise. I usually leave home about 6:30 because I like to be in clinic by 7. And especially since COVID, we've seen tons of persons trying to get out there and walk. But I've also seen tons of persons have to bail into bushes when buses are passing close and at high speed or vehicles and so on. And when there is no verge, there's no walking path. So we need as well to pay attention to our physical environment when we are talking about persons being able to exercise and use the land space that we have in order to increase their own physical activity. So what does need to change? We need to change the way that we use land. Our roads need to have some sort of facility for cyclists and persons who are walking, and public transport needs to be more reliable. And at this point, although we're talking about exercise and so on, I need to be very clear that public transport is a humongous determinant of health, just as it relates to the access to services and the access to healthcare and the access to employment. So we talked about having a good early start in life. If a mother, because she lives in a rural area, has to hope to get a bus and leave home at 5 or 6 o'clock in the morning, and she's a sole parent, then she has to leave her children. And that time when they would be communicating, getting ready for school and things of that nature, that doesn't happen. And the same thing will happen at the end of her day, that she will get home after that crucial time when homework should be supervised and things of that nature, family dinners. Those things are simply not a reality for persons. And just to feed her children, she has to let them largely raise themselves. So at the end of the day, the folks in transport who may think that they have very little to do or nothing to do with mental health, again, I hope you can see where transportation and the use of land and roadworks and things of those nature can tie in again to mental health. So education. And again, this is a big one for us in Barbados because we have a lot of quote unquote equality in our education system. But I think most of us would know that equity is sadly lacking. We know that for children, if their parents have a high educational level, they tend to have better birth rates, they tend not to die in infancy, their parents are better able to assess their health, so they will pick up early when the child has a learning disability or that child has a physical problem, and they will get help sooner. So their children tend to do better overall. And as we said, what happens to you in childhood or even in the womb, including education, that impacts your adult outcomes. Now, the basic truth is that people who have higher levels of education live longer and healthier. That is a simple fact. When you look at populations as a whole, when persons have a better level of education, they do better from a health standpoint. And we know that children from low-income families and children who have disabilities and children who have to face different types of social discrimination like bullying. And as my example of bullying, I'm going to say when the teacher tells you that you are gallows bait and you are not going to end up doing anything more than being in prison like your father, because that is a form of bullying. And children, unfortunately, do hear that from authority figures. So we tend to think of bullying as the kid on the playground who is picking on another child on the playground. But adults can make some very, very sharp dents and deep dents in children's psyche. Enough said there. But children from these types of backgrounds are more likely to struggle with mathematics and reading. They're also less likely to get secondary or tertiary level education, and they're less likely to have secure jobs. And believe it or not, when you look at persons who have this type of background, they're the ones who have a higher risk of heart disease, diabetes, and depression. So here, education starts to link with mental health. So what do we need to change? In Barbados, we have a free education system, but it is very clear that children from lower socioeconomic backgrounds who tend to have the other disadvantages that we talked about in terms of what happens in their early childhood and while mom is pregnant and things of that nature, access to food, quality of food, they have those disadvantages and then they go into an educational system that is equal but not equitable. And that's a disparity that we need to address. And if you remember the graphic with the shortest little fellow needed 2 boxes, we need to identify the children who are at risk of poor educational outcomes and make sure that they receive and identify them early and make sure that they get the help that they need. Because the reality is, this is not fair. They do not choose the disadvantage that they have, and it is up to us to actually make a difference. So I reach out to folks in education as well, because education is a huge part of what determines a person's mental health. Now, unemployment, we know what's happening in our country and across the world, and it's quite clear when we look again at populations that high rates of unemployment tend to result in more sickness and early death. It is what it is. And I'm not saying that if you lose your job today, you're going to drop dead tomorrow. But over time, populations that tend to have higher rates of unemployment, their citizens tend to be less and less healthy. So the health effects of unemployment, they're not only linked to not having money and not being able to buy the food and deal with the educational needs and housing needs that we talked about, but the psychological consequences of unemployment are actually very well studied and clearly documented negative health effects of unemployment. Negative health effects as well start even before you lose the job. When a person's employment is threatened or it's insecure, when people start to hear of layoffs before they're even laid off, the negative health effects start. And we know that job insecurity increases the rates of anxiety, depression, and heart disease. So here you see employment or unemployment being clearly linked to adverse mental health and physical health. So what needs to change? Very briefly, because we do not have tons of time. The policy has any policy, any employment policy. So here I'm reaching out to the folks in labor and also to the folks who work in people empowerment and the other social agencies and ministries. We need, wherever possible, to prevent unemployment and job insecurity. And when persons are unavoidably unemployed, we need to reduce the hardship suffered by unemployed people and try to restore people to secure jobs. So we talked about having a job, we talked about not having a job, but yes, we know having a job is better for health than having no job. However, having an insecure or unsatisfactory job can be just as damaging as having no job at all. So job quality is important. And I can almost say this and drop the mic, stress in the workplace increases the risk of disease. End of story. The way that a workplace is organized, management styles, social relationships, all of those make a big difference to health. When people have jobs that have a high demand, but they have no control over the job and how things are done, they are at very, very high risk of physical and mental illness. So it's quite all right for us to say, okay, we have, it's Mental Health Month, and we have everybody in, and the psychologists and the psychiatrists and the mental health nurses are coming in, and we are talking to the staff in your workplaces about coping skills and relaxation techniques and making sure that they exercise regularly and all of these things that will influence mental health. But the second we log off or the minute we leave, managers are on top of their workers, as people would say, like white on rice. People cannot have the work-life balance that we are talking to them about if you insist on emailing them at 5 minutes to midnight and expecting a response and action before the break of day. So it is one thing to have all of these wonderful techniques, but persons need space to implement them. If you expect persons to log on at 6 a.m. and log off at 6 p.m. or 8 p.m. or even later, then when does the exercise happen? When does the family time happen? When does the social support happen? So again, management styles need to be looked at. Receiving inadequate rewards for the effort put in is also a major health issue. And rewards aren't only money. Yes, the money is wonderful, but certainly persons need to feel appreciated and they need to have their self-esteem built through their own achievement and being allowed to achieve. So we know that that social and interpersonal environment at work is a very, very big determinant of health. So what needs to change? Well, we need basically to see health as an essential productivity input. So it is not about, as the old people would say, riding employees like a jockey mare. We need to accept that conditions of work need to be improved and persons do need to have that space to have a decent work-life balance. We need to look towards having a healthier workforce and realize that once health is seen as a productivity input and we have a healthier workforce, then instead of a vicious cycle, we can actually have a virtuous circle where persons who are healthier tend to produce more for any business, for any workplace. I want to touch a bit on social exclusion and social support. And this really has a lot to do with poverty. The UN and WHO, in their joint statement almost 11 years ago, clearly stated that poor mental health is a cause of poverty, and poverty is a cause of poor mental health. And that is something that we don't like to accept. It's not something that we like to deal with. We like to think of mental health as something kind of airy-fairy and you have a good chat and you get counseled. But reality is there are no coping skills for hunger. The coping skill for hunger is food. So we really need to look at these things from a very, very basic and very clear perspective because we cannot expect persons to be mentally healthy when their basic needs are not met. Now, social exclusion doesn't only result from poverty, racism, discrimination, and stigmatization also lead to social exclusion. And many of the clients that I see across the public health system can tell you a lot about that. This type of exclusion stops people from being able to participate in opportunities of all kinds, and it is extremely psychologically damaging. And people who have gone into and have come out of institutions like prison, children's homes, psychiatric hospitals, those persons are very, very vulnerable, and they are the persons who are likely to have a tremendous amount of social exclusion and other types of social disadvantage being stacked against them. We know that poverty and social exclusion increase the risk of all sorts of negative things: divorce, separation, disability, illness, addiction, and I'm going to touch on addiction, and social isolation. And all of those things tend to increase the risk of poverty. So you have really a vicious cycle being set up. So what needs to change? Again, I reach out to persons who are in every ministry because all policies need to remove barriers to healthcare, social services, affordable housing, and other basic necessities. Because although it is not a very cute or popular idea, unless we reduce the class division, we reduce social stratification in Barbados, where there's a huge gap between persons who have and persons who haven't got anything or do not have nearly enough, we're not going to see the overall health of our mental health as well of our nation improve. So all workers need to be protected by minimum wage legislation, and everybody needs to have access to services. And access, as we said, doesn't necessarily only have to be equal, but equitable. We need to have poverty alleviation as a major focus. And we need to have legislations that protect vulnerable groups. So we need to have legislation that, for example, says that I can freely write a sick leave and sign it myself and stamp it and not worry that just by virtue of stamping something, consultant psychiatrist, that when my client takes that into their workplace, that they don't find, quote unquote, a reason to fire them because they now know that that person has a mental health problem. So we need to have legislation as well that protects minorities and vulnerable groups from that type of exploitation. We don't need to spend much time on social support. We know that good social support has a very powerful protective effect on health. And we know that it operates not only at the level of the individual, but overall social cohesion in a society is extremely important. Inequality breaks down social relations when there are stark differences and severe class divides. Social relations in a population break down. So what needs to change? Basically, any practices that we have across any ministry, even in the private sector, any practices that cast some people as socially inferior or less valuable have to be abolished. Because if we think for a minute that we can continue to have those great divides and that those who are not in the position of need will be fine, and those who are in the position of need will just suffer, understand that the mental health of the individual impacts the family, the community, and the nation. So if you look at it, even from the point of view of children, your child, if your child is coming from, as people say, the heights and terraces, often in our education system, they may be sitting next to a child who is not. And the mental health of the child next to them impacts the mental health of your child. So we cannot escape it and think that, yes, there is some personal responsibility, but we also have to look at this from the point of view of our entire population and make sure that certain groups are not being left behind. Access to quality health care is almost a no-brainer. When people have regular and reliable access to health services, we know that it can do lots of good things, right down to increasing life expectancy. Now, even in countries that have resources, because I would not be a good psychiatrist if I did not speak about the actual access to mental health services. So even in countries that have resources, these are countries that are considered rich, mental health outcomes are not good enough. I believe the last statistic that I would have seen is that in low income countries, between 75 and 80% of mental health care, persons who need mental health care, do not get it. But when you look at the rich countries, it's still somewhere between 35 and 50%. And that's still a very high number. And why is this? Decision makers tend not to give money to mental health programs, even if you do the research. So this is not just a psychiatrist turning up, in hippie mode and saying hearts and flowers, we need money. This is doing sound research, showing the need for these programs and seeing year after year, those programs get bypassed. And that has to do with a lack of understanding at the level of policymakers for the importance of mental health, the impact that when of untreated mental illness, what happens when you don't treat mental illness, not just the individual, but their family, the productivity of that family, the socioeconomic status of that family, then the wider community, and by virtue of that, our nation. Because there is that lack of understanding, and because of that significant stigma, that surrounds issues of mental health, you tend to find that persons are not, in fact, being able to benefit because the money that is needed, the investment in mental health programs is not necessarily there. So what do we need to do? We do need to invest in mental health care specifically. And again, we talked a bit about the equity and the versus the equality in our healthcare system. We need to make sure that high quality healthcare is both accessible and acceptable. And I put acceptable there because that's very important. You would have heard Mrs. King say that I work in the polyclinic system. And I'm very thankful for the assistance and for the welcome that we receive from our colleagues in primary care. But one of the things that happens is that mental health tends to be an afterthought. Even in responding to COVID, for example, we had an excellent national health plan, but we didn't necessarily have a mental health part of that plan. That was kind of an afterthought. When it comes to the closure of clinics, for example, nobody even remembers that there is a mental health clinic that has to go on. And then when you turn up, they say, oh, shoot, because mental health is always kind of an afterthought, and we do need to change that. We need to have areas in the clinic that are private, where persons, so that has to do with acceptability. When a person comes and they want to pour out their heart, they need to say what is happening, they want to discuss things that they may not even have told their spouse. They need to have privacy. And basic private areas to see patients is sometimes lacking for us in mental health. So I just want to say we need to have high quality healthcare that is accessible and acceptable. That has to be available to everybody. I want to touch briefly on addiction because I know that our time is slipping away. This is probably not something that persons would expect to be said, but I do have to say the use of illegal drugs occurs in all social classes, and not just in Barbados, across the world. It is not only the poor who use drugs. It is not only persons in the middle class, persons from all social classes all over the world use illegal drugs. And the use of illegal drugs can actually cause social breakdown, and it worsens health inequalities, but it can also be seen as a response to social breakdown. A lot of the times, persons, especially in the lower socioeconomic groups, tend to turn to drug use. As we would say in mental health, it's a maladaptive coping skill, meaning it's a coping skill that doesn't actually help you, it actually carries you further down. And drug addiction, tends to lead to downward social mobility. However, we do need to change our approach to addiction because let's face it, the laws regarding, and I'm not talking about drug trafficking, I'm talking about the possession of illegal drugs for personal use. The laws regarding illegal drug use seem to impact more heavily on certain social groups. When you look at who faces the courts and who ends up in prison, it is not reflective of that use right through all social classes. So right now, we do need to come to a place where we stop seeing drug abuse as a crime. And again, let me be very clear, I'm not talking about trafficking in illegal drugs. I'm talking about the use of illegal drugs by individuals. We need to see it as the disease that it is, and we need to address the underlying social problems that result from the use of illegal drugs. Because as we have seen, when we punish drug use, we tend only to capture certain persons from certain classes who are already at the lower end of the unlevel playing field. And we are putting those persons in a position where they need to be incarcerated, where they are already vulnerable. They cannot then get certificates of character. So if they were not working, then they're probably not going to be working. And we know that once you come out of prison, whatever you went for, then we know that your chances of pushing yourself or digging yourself out of that hole and being able to get rid of some of the disadvantages that you already have, that's not likely to happen. So I just want to say that the way that we are fighting drug use is not working, and it is causing further disenfranchisement of people who are already disenfranchised. I'm going to just briefly mention climate change because there's a whole lot of talk about that. We talk about climate change and we talk about all of the effects of climate change on human health, but nobody tends to look down here, mental health. Climate change has a significant impact on mental health. WHO has talked about the impact on health. It highlighted it a lot quite recently, but we tend not to look again at mental health. So let's face it, it's not hard to see that if people are roasting, they can't get water, and they're having the effects of severe weather events. That, so we talked about housing and how housing has to have a serious impact on a person's mental health. But when we step back from the housing of the individual or the housing of the population, climate change is an impact on the housing of the world, on mankind's security as inhabitants of the planet there. So it's not hard to see that if our security, our housing on the planet becomes impacted, that is going to have an impact on mental health. And we have been able to see that climate change has been associated with numerous health conditions, including post-traumatic stress, suicide, depression, anxiety, grief, back to our drug use disorders as well. And again, when you look at it, the people who are already on the low end of the unlevel playing field, that would be the children, the poor, people with pre-existing health conditions, both physical and mental, they're the ones that are made more vulnerable by climate change and the effect that it has. So we're back where we started, and I hope that you aren't disappointed that we have not come again and spent an hour talking to you about coping skills. But I think if I had done that, I might need the assistance of my colleagues because I'm very tired of talking about up here when I realize in my day-to-day work that we have not dealt with the bottom of the pyramid. We have to realize that we can't get here, we can't get to the top unless we deal with what's happening at the bottom. So in summary, the existence of good mental health requires that basic needs be met. And we need a whole of government approach, not just the Ministry of Health and Wellness, but we need to make sure through every single ministry and office that everybody has a basic, reasonable standard of living. We can actually get a mentally healthy Barbados, but it is not just by talking about coping skills. It is by ensuring that we have a very sure and level foundation where persons' basic needs are met. So I thank you very much for your attention. I'm going to stop sharing my screen now and hand you back over to our moderator, Mrs. King. Thank you very much.
Colleagues, one moment, please, while I share my screen. Colleagues, are you seeing my screen? Just a moment, please. Colleagues, I'm going to stop sharing my screen just for a bit. Thank you for your cooperation. Thank you for your understanding. Colleagues, thank you for your patience. You know, they say, if anything will happen, it will happen. Okay, so we just want to thank Dr. Brathwaite-Drummond for that very interesting and thought-provoking discussion on what we can do to help others and ourselves achieve mental health care and wellness. We have provided for you in the chat the feedback form, which you can fill out. And you please do submit your feedback. It is very important to us. Now, we will look at those questions that were posted in the chat by our attendees. We have a question from Gail Carter. She's asking if there is a plan for a multi-sectoral approach to be able to execute the changes which we spoke about. Dr. Brathwaite-Drummond? She's asking to
Yes, good morning. Thanks for unmuting me, whoever did that. Um, right now, I can't say that there is a comprehensive plan to implement the things that we would have discussed. Right now, I have to say that I do find that there is too much fragmentation in what we do across ministries and sometimes duplication of effort. So at this time, if there is a plan, I'm not privy to it. But thank you very much for your question because I really do believe it's where we need to be.
Thank you, Dr. Brathwaite-Drummond. We have another question from Shanna. Shanna is asking, how do we deal with mental abusers who don't realize that they are mentally abusing persons?
Try not to laugh because I knew that question would come. And I'm almost sure that that is being asked from a workplace perspective. Hold 1 second for me because actually I'm in clinic and I am getting a request via result. Just 1 second, please.
Colleagues, as we wait, you can continue to post your questions, your comments or queries in the chat.
Yes, awesome. I'm back again. Thank you so much. Sorry about that. Um, yes, the question was, how do you deal with mental abusers? It can be very tricky, especially because persons who are mental abusers are often persons who are in a position of power. And if, for example, you're dealing with a boss or supervisor, if you're dealing with a mental abuser in the home, um, sometimes it's a matter of a minor child dealing with an adult. It can be very, very difficult to face that head on because there are repercussions. I will say that sometimes persons do not genuinely do not realize that their behavior is abusive. And sometimes simply pointing out in a respectful and calm manner how that person's behavior is making you feel or making someone else feel. If you are advocating for somebody, then sometimes that can actually affect change. Sometimes, if you are dealing with someone who is deliberately being abusive and has no intention to change, then sometimes it requires, if it's in the workplace, an HR approach. Sometimes it needs to involve some sort of disciplinary action. So, for example, I have had clients who have come from workplaces with bosses who have been extremely abusive, having the types of practices that we would have talked about, sending emails at 2 o'clock in the morning, using obscene language if they don't get a response at that time, and things of that nature. And these are people that I have ended up having to treat for anxiety and depression and literally needing medication because of the severity of the condition. And it has become necessary to actually speak with persons at the head of the company and have some sort of disciplinary action taken against that person. I'm going to say disciplinary, I'm not talking about just rushing in and firing people, because often people who behave in that manner need help. They themselves, you can't be happy and well and mentally healthy if you're spending so much time trying to persecute others. There's definitely something going on there. So we often try for remediation so that that person can learn about their behaviors, but sometimes that is not done unless there's a consequence attached to not doing so. So that would be my best recommendation. Thank you for the question.
Okay, thank you, Dr. Brathwaite-Drummond. Another question we have here. Is there a plan to take this lecture a bit further to middle managers, deputy permanent secretaries, and permanent secretaries who set realistic deadlines for employees in the public service?
To the best of my knowledge, there is no plan. But I'm quite happy to chat with the Labor Department again about mental health as an important part of occupational health and safety. We had a lot of talking about that some years ago. And I did actually speak with persons in the Labor Department about including mental health as a part of the occupational health and safety protocols. So maybe we need to revisit that.
Okay, thank you. We have here from Miguel Carter, we acknowledge that early experiences are critical as it relates to development, as this can impact life as adults. Within our sphere, we have been focusing on supporting older children and adults. What is being done to support the development of the 0 to 5-year-old age range?
Thank you for the question, Bill. At this time, and I want to say that because I don't know about it, I'm not the be all and end all, even in my small department, far less in my ministry or across education and so on. So there might be initiatives that are in place to try and boost that. But I personally believe that we tend to do a lot more with respect to the physical health. So we talk about childhood obesity and we talk about nutrition for early life and things of that nature. And again, we tend to focus more on the physical health. But for example, one of the things that I would have said to some of my students is that with respect to mental health, we need to stop playing catch up in that we know about at-risk pregnancies. So we focus in on the mothers who maybe have hypertension or diabetes or have had a complicated delivery and things of that nature. And we see those as the high risk. And, or we try to focus in there, seen more often in the physical health antenatal clinic. And that part of the pregnancy is addressed. But from my point of view, I think we also need to look at the high risk pregnancies from a mental health standpoint, because colleagues who work in the child guidance clinic and so on, often when they see kids, even primary school age, 5, 6 years of age, children come and they have myriad mental health problems at such a young age. Yet, when we look at them, because when we do an assessment for a child and we look at what's happening with the child now, we usually go back and we look at what was happening, how was mommy's pregnancy and so on. And when we see all of the things stacked against this child, we are not shocked that this child has ended up in front of us, in front of a psychiatrist at the age of 6 or 5 or 4, depending on what is happening. So from my point of view, we need to bring the mental health aspect into early life and early development as well. Look at the moms. If you have a mom who is herself coming from poor social circumstances, she is a teenager, she may not have completed her education, her own living conditions are not good, all of those things, then she is someone who needs to have early intervention with respect to mental health, and not just mental health, but all of the other factors that we looked at. Because if you bring a child into that type of situation, it's not going to be a surprise if she does not know how to raise that child, how to model pro-social behaviors for that child. None of that is going to be a surprise, and that child having a poor educational outcome, poor mental health outcome is also not a surprise. So we need to stop playing catch up and start adding mental health to the early childhood development package. Thank you.
Thank you, Dr. Brathwaite-Drummond. We have more like a query comment, sorry. There is also the major issue of actually receiving help. If you have a family member who is having a mental episode, there is no one who can help. No one helps at the polyclinics, and they instruct you to contact the police, who then turn you around.
Right. Well, I'm going to take that as a question. I thank you very much for the comment and the question in it, because it gives me an opportunity to clarify certain things before I go, because I was told 11:15 and I can see the notes beginning to pile. So I'm going to have to go, but I do want to address this. Thank you so much for your question. Now, I am part of the community mental health service that is attached to the psychiatric hospital. Many people do not know, and I almost shudder to advertise this now because we're already inundated with work. Nonetheless, people do need to know. There's a psychiatrist attached to every polyclinic and satellite clinic or outpatient clinic, whatever you want to call it, in Barbados. Anybody can access the service. Now, you may not be able to access it on the day that you walk in, but you certainly can be seen by an appointment. And if there is an urgent case, myself, the other psychiatrists, and the community mental health nursing officers and sisters who work in the polyclinics, we do our best to address those as soon as possible. If a person has an issue with a family member, then the polyclinics are only open from 8:30 to 4:30. Once we are in clinic, we will, even if we cannot see the person, we will certainly speak to the issue and direct as soon as possible. Now, the fact that the person said they were told to call the police, that suggests that they're dealing with someone who is displaying violent or disruptive behaviors and or is unwilling to engage in mental health interventions. Now, when we're talking about involuntary mental health treatment, that's a different story altogether. The Mental Health Act of Barbados allows a person to be treated involuntarily, so against their will, in one place, and that's the psychiatric hospital. Often, when relatives are told psychiatric hospital, then they don't necessarily want the help, and I do understand that, but it is really what the law allows. We try our best to assist wherever possible, but at the end of the day, people can only legally be treated against their will at the psychiatric hospital. If a relative can get their um, their family member who is having these types of issues through the psychiatric hospital, then there is no need to involve the police. However, if the person is unwilling, the relatives are unable, then we do have to interact with the police. And that, again, is something that is written into the Mental Health Act in Barbados. However, I would say to you that is the vast minority of cases. We have thousands of people who are seen in the polyclinic system for mental health problems who have never come in contact with police, and several hundreds of them have never, well, thousands really, have never had any contact with the police or with the psychiatric hospital itself. It is only in those cases where a person is not willing for intervention. And again, I should say, involuntary treatment has very, very strict guidelines. If a person is a risk to themselves, if a person is a risk to others, then we as mental health officers are supported by law to recommend involuntary treatment. But outside of those two circumstances, and being a nuisance does not equate being a risk to self or others. So sometimes we do not have the legal foothold to be able to treat somebody against their will. And I know it can be very frustrating and distressing for relatives, but we do try wherever possible to move persons towards a place where some sort of help can be obtained. Thank you very much for the question. Unfortunately,
Okay,
so
thank you.
okay, I'm gonna have to go. What I will ask, last year, Mr. Ellis was very kind. Mr. Ellis, also from the Learning Directorate, had captured questions that I was unable to answer in the given time and sent them to me via email, and I was able to type responses. So if that can work for some of you, then please continue to forward your questions, and I may not be able to respond this evening, but I will certainly send a response and I will forward it to the Learning Directorate so that you are able to get the answers to the questions that you have asked. Thank you so very much for having me this morning, and thank you again for your attention and participation.
Thank you once again, Dr. Brathwaite-Drummond. And colleagues, of course, yes, we will compile your questions and pass them on to Dr. Brathwaite-Drummond. So it is at this time that I would like to encourage you, as I mentioned before, to complete our participant feedback form, which has been, the link has been dropped in the chat box for you. Click on that link and complete that form. Or remember, your feedback is very important to us and it helps us to improve our production, such productions for you. Dr. Brathwaite-Drummond, again, thank you very much on behalf of the Director General, Ministry of the Public Service, the management and staff of the Psychiatric Hospital, the Learning and Development Directorate team, and of course, our attendees for taking the time from your very busy schedule to have this important discussion with us. I thank you all as well attendees for your participation, your questions, your comments. And many thanks as well to our producer, Mr. Sherwayne Ellis, who was working in the background to give us some assistance. Colleagues, let us not just think about what was just shared with us. The least, let us try to put some action to these thoughts, even to start to take care of our own mental health and our health in general. Remember, no health without mental health. So each of us, let us try to play our part in helping others to achieve good mental health. Together, we can make a difference. Happy mental health, everyone. Please do enjoy the remainder of your day. And thank you again for your participation.